This presentation contains current information about senior hunger in the state of Arkansas. It is designed for individuals or groups to share knowledge in their own communities, and it is ideal for events such as Lunch and Learns. You have the option of launching the self-running slideshow, or you can use the notes provided to present the material yourself. If you have any questions or comments, please contact Tomiko Townley at ttownley@arhungeralliance.org. Hunger and food insecurity among older adults in Arkansas is a serious but often hidden problem. Here, we'll review the current information on this topic, as well as explore some of the potential causes and actions that we can take as citizens to address the problem. First, let's define a few important terms. When someone is hungry, it means that he or she is experiencing physical symptoms due to a lack of food. Unlike hunger, however, food insecurity is not a temporary sensation. People are thought to be food insecure when they are forced to reduce the frequency, size, and/or quality of their meals due to a lack of financial resources or access to proper nutrition. Malnutrition is a medical term and can result from chronic hunger or food insecurity. Each year, the National Foundation to End Senior Hunger publishes a report on the state of senior hunger in America. Since 2011, this group has named Arkansas as having the highest percentage of adults over the age of 60 that are facing the threat of hunger. According to the most recent data, 24.85%, or nearly 1 in 4 older Arkansans, are in this category. It is important to note that the report's authors rely on data collected by the Census Bureau, and although scientifically respected, these data provide an incomplete picture of the problem, since the data result from a survey that is conducted on a small sample of people in primarily urban areas. In short, the available data may not be useful for advocates, policymakers, and service providers. Field staff at the Arkansas Hunger Relief Alliance see the pangs of hunger and food insecurity in the faces of their clients on a daily basis. They know there is a problem. However, no one has systematically collected data on senior hunger in every part of our state. The Alliance is working to change that. In the meantime, we do know that food insecurity is associated with heart disease, stroke, diabetes, cancer, obesity, and depression, among other diseases. We also know that food insecurity is expensive. Some estimates show that food insecurity leads to increased healthcare expenditures in the United States of up to $160 billion annually. For older adults, food insecurity can be a vicious cycle. As a result of not having enough good foods to eat, seniors get sick, they have to pay more for health care, and thus have even less in their budgets, which often rely on fixed incomes, to purchase healthy foods. What's more, food insecurity among older adults is poised to grow due to 2 factors. First, the U.S. Administration on Aging reports that the older adult population in Arkansas will increase 25% by 2030, at which time older adults will comprise 26% of the state's population. Second, the AARP reports that 30 to 35% of Arkansans aged 40 to 49, an age group otherwise known as the young old or pre-seniors, are already struggling with food insecurity. We can expect this problem to worsen with age. Senior hunger and food insecurity is a complex issue, and a single individual can encounter many barriers to food security, including some of these you see on the screen. According to the USDA, it is not uncommon for Arkansans in urban areas to have to travel a mile or more to the nearest grocery store, and up to 20 miles in rural areas. This is especially troublesome when there is little to no access to reliable public transportation. Senior hunger and food insecurity can also result from poor health, aging-related issues, or medical procedures. Other factors may also contribute to hunger and food insecurity in older adults. Various organizations in Arkansas, including the Department of Human Services, are examining the existing patchwork of services for older adults. We are looking to other states and cities for ways of addressing senior hunger. You can see here some of the innovative solutions we have identified. As the CDC defines them, food deserts are areas that lack access to affordable fruits, vegetables, whole grains, and other foods that make up the full range of a healthy diet. In the inner city, for example, residents may only have access to fast food restaurants and corner stores filled with processed foods high in calories and low in nutrients. In Little Rock, the Arkansas Hunger Relief Alliance created a mobile market in an old donated city bus. The Fresh to You project took a lot of work to get off the ground and is the result of a partnership between several organizations, including Arkansas Blue Cross and Blue Shield and Heifer Urban Farms. Each week, the market makes 2-hour stops at designated times in several of the city's underserved areas. We've seen that many states have focused their anti-hunger efforts on the Supplemental Nutrition Assistance Program, or SNAP. Because the program is federally funded and it has a good track record of lifting families and individuals out of poverty, it is often used as a frontline defense in combating hunger and food insecurity. In addition to supplementing SNAP benefits with state funds to increase older adult access to food dollars, some states have conducted mass outreach and educational campaigns aimed at reducing the stigma associated with government assistance programs. The Government Accountability Office gives SNAP high marks in efficiency and reports that, contrary to stories that are widely reported in the media, 98% of SNAP funds go directly to program beneficiaries. In fact, fraud and abuse occurs with just 1% of benefit dollars. Additionally, a majority of the households that participate in SNAP contain children, older adults, and people with disabilities, and most people who utilize SNAP benefits do so temporarily. Older adult participation in the SNAP program, however, is generally low. A combination of census and internal data shows that an estimated 73% of eligible Arkansans over the age of 64 are not currently accessing SNAP benefits. This is a target area for improvement. One way to boost SNAP participation rates among older adults is by simplifying the application process. The Division of County Operations in the Department of Human Services has applied for the waiver that will allow them to participate in the Elderly Simplified Application Project. Arkansas is one of only 2 states in the nation where fewer than 20% of the population has access to 211 services. The expansion of 211 in Arkansas would allow seniors and their caretakers to call a hotline, enter their 5-digit zip code, and get quick access to various health and human services in their area, including food pantries and food banks. We've seen some of the methods being used to combat senior hunger and food insecurity around the country. So, what do you have the power to change? Advancements in medicine mean that people are living longer, oftentimes longer than their retirement plans projected. Learn about the positive benefits of SNAP and spread the word. Anyone over the age of 60 with few assets and income of $990 a month or less, after expenses are deducted, may be eligible for SNAP. Applications may be completed at your DHS county office or online. If you know of an older adult who needs help with his or her application, contact the Arkansas Hunger Relief Alliance at 501 399 9999. If you are a gardener, consider donating any extra produce to older adults in need. Hosting a fundraiser for a hunger relief agency is an excellent way to help in the fight against hunger. Many people prefer to work with their hands, donating time at their local food pantry or food bank in the fight against hunger. This is a popular way to give back. But if you choose this route, be sure that you volunteer with the same organization on a regular basis, so the staff can come to depend on you. In this way, you can be a real asset. For many homebound older adults, able-bodied neighbors can be a lifeline to the outside community and to the nutrition they need. If you feel uncomfortable making cold house calls, consider contacting your local senior center about becoming a Meals on Wheels volunteer. Home-delivered meal programs provide the recipient with good nutrition as well as opportunities for companionship and social interaction. Many area agencies on aging also have volunteer opportunities with senior companion programs and serving congregate meals at senior centers. Finally, you can put your professional skills to work for a local nonprofit that may not have the resources to fill full-time skilled positions. Consider volunteering your time and your skills in a meaningful way. Do you have any ideas about how to address senior hunger in your community?